Okay, this is the assessment of a newborn or an infant. First thing you want to do, be sure you have a room that is warm, you have a good light. You're gonna keep the baby in the mother's or father's lap while you're gonna do the examination. Also, you're gonna explain the parent everything you're gonna do, and you can sit next to them and just at the same eye level with the parent and the baby. You're gonna wash your hands with warm water. Just be sure that they are warm before you touch the baby, and same with the stethoscope. First thing you're gonna do is observation. You're gonna observe the general appearance of the baby, the skin color, the respiratory pattern, if the baby is active, if he's crying. And then if the baby is calm and is not crying, maybe sleeping, you're gonna go ahead and auscultate the lungs, the heart, and the abdomen before the rest of the examination. There are two main assessments that you do in a newborn. One is the APGAR score assessment, and the APGAR, you do it when the baby is just born, and then you do it at 1 minute and then 5 minutes after. And basically you evaluate 5 physiological components, which is the muscle tone, the reflex irritability, the respiratory rate, the heart rate, and the color of the skin. The ideal value is between 7 to 10. You can get a 0, a 1, or a 2 from each factor that you're assessing. The idea, like I say, 7 to 10. You can have a 4 to 6, which would be like a mild respiratory depression, or 0 to 3, which would be a severe respiratory depression, and that baby is going to end up in NICU. And the other assessment is the Ballard assessment, which has 2 components, the neurological maturity, and also it's going to evaluate the physical maturity of the newborn. Continue with the general assessment of the baby. So first you do a general survey, and like I said, you're going to look for the muscle tone, the symmetry of the movements. You want to be sure that the baby is not having a labor or difficulty respiratory breathing pattern, and also that he is interacting well with the parent or to the nurse. So then what you're gonna do is you're gonna check the vital signs. So you check for temperature. The expected is 36.5 to 37 degrees centigrade, just like an adult. If it's the first month, you usually use the axillary temperature. After 1 month, you can use also the tympanic temperature. You're gonna check for the respiratory rate. The expected is between 30 to 60 respiratory during 1 minute, and that's for the first month, and then it can decrease to between 22 to 35 per 1 minute after 1 month. Also, the heart rate in the first month, the newborn, could be the 110 to 160 beats per minute, and after 1 month it can go to 80 to 140 beats per minute. And you will check the heart rate in the apical pulse. And those two, respiratory and heart rate, you're gonna check for a whole 1 minute. And also, usually blood pressure you don't check on the newborn, but if you do, you should check the four extremities. If it's during the first month, you can expect a systolic value of between 50 to 70 millimeters of mercury, and after that, it could be between 70 to 100 for the systolic value. After vital signs, the other thing you're going to check is you're going to do measurements. So you're going to weigh the baby, you're going to see the height, and usually you go from the crown of the head to the heel. You can mark with a pen, and then you move the baby, and then you're going to measure. You're going to measure the head also the breast. The most important thing with the measurements is first to do a comparison, and also you're gonna plot those values in a growing chart, and just be sure that those values are below 90% percentile and above the 10 percentile. Measurements also, you can assess the pain. You know, if you have a baby that is continuously crying, very irritable, and it doesn't calm down after being fed or after changing a dirty diaper, is something that definitely you gotta investigate what's going on. Another thing is the mental status. Basically, a healthy baby is a baby that is going to be active, that has a good interaction with the parent or with the nurse. You know, if it's 1 month, maybe just it's gonna look at your eyes during the examination, or if it's over a month, maybe by 3 months, you're gonna put an object close to them and they are try to reach to the object. If it's a baby that is extremely irritable, that might be an early sign of mental status that is going bad. Or if it, on the other side, if it's already a baby that is very lethargic, that can be a late sign of deterioration of the mental status of the baby. Alright, also signs of violence. You know, you don't want to see any injury in the skin. You're going to check for the grooming and the dress, be sure the baby is clean, and also the interaction with the parent. Okay, so going back to the physical assessment, you're going to check the head and the neck. So you're looking for basically the shape of the head, the size, and the symmetry. Main thing in the head, you're gonna check for the fontanella. The anterior fontanella usually closes at the age of between 9 months and 18 months, and the posterior fontanella usually the 3 months of age. Sometimes at the birth it's already closed. Main thing with the fontanellas is when the baby is at rest and sitting, it should be flat. Maybe the baby start crying, it can bulge a little bit, but if the baby is not crying and he's resting and you find a bulging of the fontanella, you might think about the intracranial pressure is increased or hydrocephalus. Also, the fontanellas are important when you have a dehydrated baby.